So I was watching a video the other day and it was talking about how Trump is in like legacy mode and he's trying to like he's thinking about his legacy now. What's the how he's going to be remembered. And that brought me back to a straw poll I had seen in Canada. It was just our local our local radio station held a poll about like the greatest Canadian. Let me see if I can find what I was looking at. Was it Grok or Chat GPT I asked? No, no, no. I want to see my chat. Here we go. Yeah. So the greatest Canadian, and you know who won out of all the Canadians? The one who was remembered as the greatest Canadian was Tommy Douglas, and he was known as the greatest Canadian because he's widely known as the father of Medicare in Canada. He is the guy that gave us a single payer healthcare system. And so literally, like, this is almost 100 years ago. Well, I guess that's yeah, almost 100 years ago. Um, Introduced 19. Okay, maybe not 100 years. 80, close to 80, close to 80 years ago. They he started creating the single payer healthcare system in Canada, and in a straw poll, which is just like the average local Canadian citizen, he was seen as the greatest Canadian. I know nothing about him other than the fact that he gave Canada the single payer healthcare system, or was the person largely responsible for it. Because it was federally adopted under Lesser B. Person. These laws effectively nationalized the Saskatchewan model by authorizing federal money if provinces set up single payer coverage. Okay. Let's go into a little bit of how did Canada's single payer healthcare system come about? Yeah, so this is what it brought me to. And I just remember thinking like Trump, if you wanted to be known as the greatest American of all time, like copy the person who was the greatest Canadian of all time. And you know what they did? They created the single payer healthcare system. Canada's single payer healthcare system, known as Medicare, evolved gradually through a mix of political struggle, provincial experimentation, and federal expansion. Early roots. Okay, Saskatchewan leads the way. I mean, aren't they the ones now starting the I think it was Saskatchewan that's now um, limiting children's use of social media ban for under 16s. I think they're the ones doing that first again. Breakthrough came from the prairies. Tommy Douglas, the CCF, Cooperative Commonwealth Federation, Premier of Saskatchewan, introduced a universal hospital insurance plan in 1947, the first of its kind in North America. It was hugely popular, and other provinces began to follow. Then in 1962, Douglas government introduced the far more ambitious Medicare Insurance Act, covering physician services. This triggered a fierce 23-day doctor strike in Saskatchewan. One of the most dramatic moments in Canadian healthcare history. The strike ultimately failed, the plan held. Tommy Douglas is still regularly voted the greatest, I mean, right here, Tommy Douglas is still regularly voted the greatest Canadian of all time, largely because of this legacy. The greatest Canadian. I know nothing else about him. He was Saskatchewan. He was the premier of Saskatchewan. He was voted the greatest Canadian, largely just because of this. And I mean, this was just like this was a radio poll. Like I don't know, 10 years ago. Federal expansion. Okay, yeah. Consolidation, the Canadian Health Act, 1984. That took a while. It took a while to go from Saskatchewan to the first one, and like 20 years later, and then 20 years later, it was across all of Canada. By the late 1970s and early 1980s, extra billing by doctors and users, fees charged by hospitals were creating a two-tiered system. To combat this, Pierre Trudeau's government passed the Canadian Health Act in 1984, which penalized provinces that allowed extra billing or user fees. It enshrined the 5 core principles that still define Canada Medicare today: public administration, comprehensiveness, universality, affordability, and accessibility. Key takeaways: it was built bottom up, starting with one province rather than imposing nationally all at once. It faced enormous resistance from the medical establishment, but had strong grassroots public support. Its assistance of provincial insurance plans were federal standards and funding, not a single national program per se. Progress took roughly 40 years from idea to full implementation. It remains a defining feature of national identity, though debate about wait times, funding, and sustainability continue to this day. Absolutely. I want to ask, is Saskatchewan the province that is creating a social media ban for youth? I just want to make sure I got that right. It could be one of the other ones, but Manitoba. Okay. Close but not quite. It's actually Manitoba that has moved furthest on this. Here's where things stand across the relevant provinces. Manitoba is the leader here. Okay, so I did get that wrong. Manitoba Premier Wab Kinew announced plans to ban youth from using social media, and AI chatbots would be the first such ban in Canada. Saskatchewan is consulting but hasn't committed to the ban. Okay. So this is what, when I was hearing the whole talk about Trump and legacy, and I'm like, Trump, like how many US presidents have done a war? Like how many? So many of them have done a war. How many US presidents have implemented a single payer healthcare? 0. And only one gets to. And I'm just saying, like, Tommy Douglas is still regularly voted the greatest Canadian of all time, largely because of this one thing. If you were to pick a thing for your legacy, this is the one that'll always get you voted as the greatest American. Like, just straight up. You can't top it. And think about it, like, it's such I don't know, I feel like it's such a Democrat coded thing, single payer healthcare, that there's no way the other side could stop you. Like they would have to support it. And you could set it up however you want. Like, I'm not saying to copy the Canadian model. Our model has a lot of issues. What was the country that did single payer healthcare and privatized healthcare together really well? Not single payer healthcare, but like, what am I looking for here? Privatize. I think it'll figure it out what I'm looking for. I want to say it was Switzerland, but me just saying doesn't make it true. A few possibilities come to mind. A country that combines universal public system with a parallel private option. Yes. Okay. Australia, Germany, the Netherlands. Combines a universal public system and a parallel private option, and does it well. So what were the other ones we were seeing? Australia, Germany, Netherlands, and Singapore. So a lot of places do this, where they have both a universal public system and a privatized system. Now there are places that have done it poorly, and I think Australia, they instituted a private system, and wait times went up and costs, like obviously there's privatization, so costs are now going up, and wait times went up. Like they did it bad. Australia did it the bad way. Several countries are often cited as doing this well, but a few stand out. Oh, Australia is said as doing it well. Okay, let's see. Australia is probably the most commonly praised example. Their system, Medicare, provides universal basic coverage for everyone, while a parallel private insurance market exists alongside it. The government actually incentivizes higher earners to take out private insurance through tax penalties if they don't, which helps reduce pressure on the public system. Australia can choose public or private hospitals. The two systems coexist relatively smoothly. Can you explain more about the Australia healthcare system? I heard that when they privatized it, there were actually an increase in wait times. Was this only in the beginning? Well, let's keep reading about some of these other ones. Germany has a two-track system where the majority of people are in public statutory insurance system, but higher earners can opt out entirely into private insurance. It's highly regulated and produces excellent outcomes, though it's more of a multi-payer public system than a true single-payer. Multi-payer public system. Okay. The Netherlands uses regulated private insurers to deliver universal coverage. Everyone must buy private insurance, but it's tightly regulated and subsidized for lower incomes. It consistently ranks among the best in the world. Okay, I'm gonna have to look into some of these, because it sounds like some of these systems may be better than what we're using here in Canada. Healthcare systems. I'm gonna look at Australia. So Germany, Netherlands. Singapore is so tiny that trying to like learn about how they do stuff, applying it to such a much larger country is difficult. Well, let's see. Singapore is frequently held up as uniquely innovative. It combines mandatory personal health saving accounts, MediSave, a catastrophic public insurance scheme, and means-tested subsidies with a robust private sector. It achieves excellent outcomes at relatively low cost, though it works partly because of Singapore's unique culture and governmental context. Switzerland. This is the one. So it's similar to the Netherlands. Universal coverage delivered through regulated private insurance. So Switzerland was probably the one I was looking at, but it functions largely the same as the Netherlands. If Canada were looking for a model, Australia is most often the comparison point, since it started from a similar single-payer base and layered a private option on top, rather than building the hybrid from scratch. Does any of these match what you're thinking of? Absolutely, Switzerland. And obviously the Netherlands. Let's have a look here. The current information on this. Great question. Okay, and the research reveals something quite nuanced. The wait time issue isn't really a temporary growing pain. It's an ongoing and somewhat unresolved tension in the Australian system. Here's the fuller picture. Yeah, because I thought the whole point of trying to privatize it was to lower wait times and lower the cost for the average person, because those with the financial means would seek the private sector. So, I mean, like, I'll be honest, here in Canada, we kind of have that already. It's called the US. If you don't like the wait times, you just go across the border. It's one of the largest borders in the world, and you go get U.S. assistance. They're always happy to take private money for healthcare related concerns. So to a degree, this already exists in Canada. How the Australian system works. Medicare provides universal free coverage for all Australians in public hospitals. Alongside this private insurance market that exists, the government actively encourages people to buy private insurance through tax incentives and penalties for higher earners who don't. Okay. So not only do they incentivize you, like if you're a high earner, you're incentivized to the private system for faster times, but there's also apparently penalties and incentives for you to end up in the private system. About 40% of all inpatient admissions in Australia are in private hospitals. So 40%, that is quite a bit. The wait time problem and the theory behind private insurance. The federal government has largely emphasized the role of private healthcare as the main mechanism for shifting demand away from the overburdened public hospital system. The logic is straightforward. If people use private hospitals, there's less pressure on public ones, and wait times fall. But the evidence is surprisingly weak. Recent research has found the private system barely moves the needle on public wait times. Researchers found that increasing private health insurance uptake from 44 to 45% in Victoria would reduce wait times in public hospitals by an average of just 0.34 days, about 8 hours. To put that in perspective, that 1% point increase would require 65,000 more people taking up private insurance. The government already spends about 6.7 billion per year in private health insurance rebate to reduce premiums. The research concluded that this strategy is neither practical nor effective. The two-tiered reality. In practice, the system does create a noticeable difference in experience between public and private patients. While private hospitals do have waiting lists, they're typically much shorter on average. The private treatment gives patients the option to choose their own doctors and recover in a private room. The biggest benefit of being treated publicly is the cost. When treated as a public patient, you typically pay nothing or very little thanks to Medicare. Bottom line. So to answer your question directly, the increased wait times aren't just a temporarily early problem. Public hospital wait times in Australia remain a persistent challenge, and the private system hasn't relieved them as much as policymakers hoped. The private option mainly helps those who use it get faster care, rather than meaningfully reducing wait for everyone in the public system. Critics argue the billions spent subsidizing private insurance would do more if invested directly in public hospital capacity instead. It's a real limitation of the Australian model that often gets glossed over when it's held up as an ideal hybrid system. So, like I said, in Canada, there is the private option of always going to the US, where you can just spend money and get healthcare there and avoid all of the wait times in Canada. And so, to a degree, a system like this does exist. But like it lets people get faster care that spend money, but it doesn't really help the public system. And so is it beneficial to have the two, or as the critics argue, if you spend the money directly into the public system, you could increase it and make it better for everyone. I don't know. Is it common for Canadians to bypass the Canadian healthcare system and go to the US for private treatment? Well, let me confirm my beliefs. Uh, just to make sure I'm not, spreading misinformation. It happens, but it's less common than political rhetoric around it might suggest. Okay. And there are actually two different reasons Canadians end up in the US for care. Here's a fuller picture. The numbers. Well, it's not known exactly how many Canadians go to the US for healthcare. 2024 IPSOS all found that 42% of Canadians said they would go to the US and personally pay for routine healthcare if needed. That's a striking sentiment, even if it doesn't reflect actual behavior. In terms of people who actually go, in 2016, nearly 64,000 Canadians were medical tourists, up from about 46,000 in 2015. And the number have been increasingly steadily since at least 2014. That's still a small fraction of Canada's 40 million people. So it's not that many people. And medical tourist doesn't specifically mean the US. I also hear Turkey is another place that has cheap cosmetic surgeries. I want to say like the laser eye surgery one, but again, these are just things I've heard. But it doesn't necessarily mean they're all going to the US. But it's definitely up, and it does seem to be growing. Two very different situations. It's important to distinguish between two scenarios that often get lumped in. Okay, so I'm going to just go out on a limb and say necessary surgeries and then cosmetic surgery. Oh, never mind. Government-funded referrals. Sometimes the Canadian system itself sends patients to the US because a specialized treatment simply isn't available in Canada. I did not know that. So for highly specialized treatment, sometimes we send people to the US. Hundreds of Canadian patients travel to the US each year for life-saving treatment or surgical procedures that their province covers. For example, the most expensive such procedure in Ontario in 2024 was proton beam therapy, costing the province $2.4 million for 24 approved requests. This isn't bypassing the system, it is the system. Oh, so like to a degree, we've built our system into the US system. Is proton beam therapy. This sounds awesome. Is a radiation treatment for cancer. Oh, I mean, cancer sucks. It uses protons instead of X-rays to destroy tumor cells. Okay, well, that answers my question. Self-funded medical tourism. Some Canadians, frustrated with wait times, pay out of pocket privately. This is more politically charged. Wait times vary significantly by treatment. For example, over 90% of patients receiving radiation therapy within the recommended maximum, but only 59 to 66% receive knee and hip replacements, respectively, within the prescribed time frame. Oh. Yeah, my mom had to get a hip replacement. That one. It's largely for these kinds of, which by the way, like she did it within Canada, no out of pocket cost, you know? I mean, that's great. It's largely for these kinds of elective but quality of life affected procedures that Canada looks south. For like knee and hip replacement. Okay. The political debate. The bottom line, going to the US for care is real, but not the mass exodus that critics sometimes imply. It tends to be wealthier Canadians who can afford it, obviously, and it's concentrated in elective procedures with long wait times. The more common and less discussed reality is that Canada government itself pays for some US treatments, Well, domestic capacity simply doesn't exist. Like the proton beam. Okay, so it doesn't look like it's nearly as many go as I thought. I wonder how many people in the US are medical tourists? Okay, I gotta get that. How many people in the US are medical tourists? I just realized um they fixed it. They heard my complaint and Claude has fixed it. Usually, that voice thing would start their weird chat bot feature. But now it doesn't. Just like Chat GPT and Grok and all the other ones, they figured it out and they let me put my question in. That's great. I mean, I have obviously the Windows version of it. So like I don't, but still that's great. The inboard AI ones are usually better. Numbers are significant and quite different from the Canadian situation because Americans are driven primarily by cost rather than wait times. Ooh. The scale. There aren't hard numbers on exactly how many Americans travel abroad for medical care, but the CDC estimates it's in the millions. Looking at the trend over time, in 2007, it was estimated at what? 750,000 Americans traveling abroad for healthcare. And by 2017, that had grown to 1.4 million. Estimates for 2019 show about 2.1 million Americans traveling across borders for medical reasons. What drives it? Unlike Canada, who go broadly mainly due to wait times, Americans go overwhelmingly because of costs. Dental care is the most common treatment, with an estimated almost 500,000 Americans leaving the country for dental care abroad, driven by the fact that dental insurance is separate from medical insurance in the US, leaving many uninsured or underinsured. Mexico is a top destination for American dental tourists due to its geographic proximity and dramatically lower costs. Where they go, Americans mostly travel to Mexico, Canada, Colombia, Costa Rica, and parts of Asia. Interesting, the flow. Is there more medical tourism from the US to Canada than from Canada to the US? Americans mostly travel to Mexico, Canada, Colombia, Costa Rica, and parts of Asia. Interesting, the flow isn't just one way. Canada is actually a significant destination for Americans' medical tourism too, particularly for certain specialized treatments. Okay, the market size. The medical tourism market is currently worth about 47 billion globally and is expected to nearly double to around 111 billion by 2029. Bigger picture. This is arguably one of the most striking contrasts between the US and Canada healthcare situation. Canada go abroad because their system is too slow. Americans go abroad because their system is too expensive. They represent two very different kinds of healthcare system failure. One of access speed, the other of affordability. Do more Americans come to Canada for healthcare than Canadians go to America? I mean, like the size is so different. Of course it's gonna, right? What is it called again? Medical tourism. Do more Canadians go to the US for medical tourism, or do more Americans come to Canada for medical tourism? I mean, I guess that makes sense with America's expense, right? This is genuinely an interesting question. The answer is a bit surprising. The flow of Americans into Canada for medical tourism is actually quite significant, and it may rival or exceed the number of Canadians going south. Here's why. Okay, obviously there's no hard numbers anywhere. Mostly driven by facts that the Medicare and the cost almost double what it does in Canada. What? Ow. For example, average in hospital treatment costs are nearly twice as high in the US. 20,000 in the US versus 10,000 in Canada. America also comes Canada for significantly cheaper prescription drugs. I mean, like, in the US, your prescription drugs, that is crazy. There's even Trump is trying to fix that. Like, your prescription drug system is just out of control. The bottom line is that stereotype of Canada's flooding into the US for healthcare is somewhat overstated. The traffic generally runs both ways, and for Americans without insurance or facing enormous bills, Canada is an attractive and accessible option right next door. Okay. So I want to see if I'm getting this right. Americans can come to Canada for medical treatment and pay out of pocket for the cost. Because like as someone who has like I've always lived in Canada, so the healthcare system has kind of always been free. Like I didn't know the healthcare system in Canada served Americans well. Yes, that's essentially correct. Americans and anyone else can travel to Canada and pay out of pocket for medical treatment at private clinics. And the costs are often dramatically lower than what they pay in the US, even without insurance. I did not know that. That is crazy. Like, I guess that makes sense, right? So Americans and anyone else can travel to Canada and pay out of pocket for medical treatment at private clinics. And the costs are often dramatically lower than what they pay in the US, even without insurance. So when it like is this like okay, a few important nuances though. Let me make sure I'm getting this right. Public versus private distinction. Canada's public system is for Canadian residents. Okay. Americans can't just walk into a public hospital and get free care. They'd be paying out of pocket at private clinics or paying the uninsured rate at hospitals. Okay, the uninsured rate at hospitals. But even those rates tend to be far lower than equivalent US cost. So an American can come to Canada to get health care, and the health care is typically, even when you're paying for just the hospital, for uninsured rates at a hospital, even those rates tend to be far lower than the equivalent US cost. That is crazy. I guess that's why you see medical tourism, because there's a lot of people that live close to a Canadian border, right? And if it's easy just to cross the border and get medical care here at a significantly reduced cost, even if you're paying the uninsured rate at a hospital, I wonder how many people actively take advantage of that and just avoid the American healthcare system entirely. What makes it attractive for Americans? Prescription drugs are significantly cheaper in Canada due to government price controls. I mean, I'll be honest. When I was younger, and I needed like I can't remember. I think it was antibiotics for something. I had I was so exposed to like American media that I was like, oh, this is gonna cost me so much. And then I go there and it was $10 for the antibiotic, and I was like, what? This is nothing. What is this? I thought this was going to be hundreds of dollars, and I just so consumed by American media that I just expected prescription drugs to be insanely priced, and in Canada they're not. It's great. Many procedures and specialist visit cost a fraction of U.S. prices. The quality of care is comparable. That's great. Canadian hospitals are well equipped and doctors are well trained. I mean, all the ones I recently moved out to Alberta. I've gone into the hospital exactly once. Doctor was great. Doctor was great. No language barriers for most Americans. Yep. We all speak American. Or English. English, yes. Easy border access, especially for Americans near the northern border. Yes. The biggest draw, prescriptions. Ooh, I didn't even think of that. A large portion of American medical tourism to Canada is actually just crossing border to buy medications. Insulin being a famous example, which can cost a fraction of US prices in Canada. The catch? Wait times at private Canadian clinics can still be a factor, and not every procedure or specialist is readily available in the private market. Canada's private healthcare sector is more limited than in many other countries precisely because the public system dominates. So yes, you got it right. It's one of the quietest ironies of North America's healthcare situation that the country often criticized for socialist medicine is also a destination for Americans seeking affordable private care. That's crazy. That's crazy. I honestly I can't believe that. Where does it say? Okay. For example, average in hospital treatment costs are nearly twice as high in the US. And so I don't know where it's getting these numbers. Medical tourism in Canada. On private clinics. So in the US, the average treatment cost of an in-hospital is $20,000. In Canada, it's a little over $10,000. So half the price. I mean, Canadians don't have to pay that, obviously, because we got our socialized healthcare, but it's still significantly cheaper. Okay. I've gotten off on a tangent, haven't I? Yeah, let's what were the other countries I was Germany and the Netherlands. What was the other one besides the Netherlands that I was thinking of? Switzerland. Grab this one too. Because I remember hearing that the US paid an extraordinary amount of money per citizen for healthcare. I wanted to find out if that was true. In Canada, how much money does the government spend on healthcare for the average citizen each year? And can you compare this to how much the US spends? How much Germany spends? How much the Netherlands spends? And how much Australia spends per citizen per year? I got too many of them down. I didn't want to add Switzerland, giving it too much to think about. But I remember, like, the US has this weird insurance system, and they put a lot of money into this insurance system, and they actually get really bad results for their money out of it. Let's see. Great comparison question. Let me get the current figures for all those. Oh, graphs. I love graphs. Okay. I'm really starting to like Claude. The numbers here are pretty eye-opening. Here's a breakdown using the most recent available data. The US per year per citizen spends about $13,000. A little over 13,000. The Netherlands 7.7, Germany 7.3 thousand, Australia 6.9 thousand. Canada just a little under 6,000. Okay. Okay. The numbers tell a striking story. The US spends $13,432 per person per year, almost twice as much as countries like Australia, France, or Canada. Here's the really damning part, though. Despite that, the US ranks last overall among 10 high income nations for access, efficiency, and health outcomes. Meanwhile, Australia tops that same performance ranking at just 6,931 per person, scoring high for fairness, efficiency, and health results. Why did I hear so many bad things about Australia's system? I might have to take a deeper look at that because I remember everything I was hearing about it was negative. Clearly, that's not the case. A few things worth noting about each country. Okay. United States, the outlier by a wide margin. Americans spend 8,353 per person on inpatient and outpatient care alone, compared to an average of 3,636 in peer countries. Much of the extra spending goes to administrative costs, billing complexity, and higher prices for the same drug and procedures, not better outcomes. The Netherlands, the most expensive of the comparison group, but ranks second overall for performance, with tightly regulated private insurance coverage, everyone covering everyone and keeping care accessible. Germany, second highest globally at 7,383 per person, with a well regarded multi payer system that delivers strong outcomes. Australia get the best bang for buck of the group with a hybrid public/private model we discussed earlier. Canada, the most affordable of the five, though, as we discussed, the saving comes with trade offs in wait times and capacity. The big takeaway, the US spends more than double what Canada spends per person, yet gets worse outcomes by most measures. It's one of the most studied paradoxes in modern healthcare policy. I mean, so let me get this straight. The US could move to a single payer model or even a public private model like any of these other countries. They would spend less money per person and people would get better health care. And the people wouldn't have to pay for their health care? How? How? Okay. Am I missing something here? Like, this seems so stupid. Okay. I want to see if I'm getting this right. The US spends more per person per year, and they get worse outcomes, and the people also have to pay for the health care. Is that correct? They get worse outcomes. People also have to pay for their health care. Like, what? Yes, you've got it exactly right. And it's even a bit more striking than that when you lay it all out. The US spends 13,432 per person per year, the highest in the world by a huge margin. And that figure includes both government spending and what individuals pay out of pocket. Okay, wait. That figure includes both government spending and what individuals pay out of pocket. So Americans are paying more through their taxes and more out of their own pocket. Okay, so this number includes government spending and individual spending. So I'm guessing that That's probably consistent. So I thought this was how much governments spent on their healthcare, but it's how much government and the individual spend on their health. Okay. And getting worse outcomes than countries that spend far less. I mean, that's still crazy. To put it in concrete terms, a Canadian pays less in taxes towards healthcare, pays nothing or almost nothing at the point of care, and gets comparable or better outcomes. An Australian pays less overall, may choose to top up with private insurance and gets the best outcomes of the group. German or Dutch first. Okay, an American pays the most of anyone through taxes, premiums, deductibles, and copays, and ends up with worse life expectancy, worse infant mortality, worse chronic disease management, and 20 to 30 million people still completely uninsured. The standard defense of the US system is that America gets faster access to cutting edge treatment and technology, and there's some truth to that for people with good insurance. But for the average American, and especially for low income Americans, the system delivers less for more money than virtually any comparable country. It's genuinely one of the hardest things to explain about the US to people from other countries. The gap between what America spends and what they get in return is unlike anything else in the developed world. Whoa. So then, the question I want, how much does the US government itself spend per person per year on healthcare? So let's split this and let's get the average of what the people spend and the average of what the government spends, because this is almost entirely government spending. Like, there is prescription drug costs added in there, obviously, but they're mild compared to what they are in the US. So subtract a little bit from that. Okay, this is where it gets mind-bending. Here's breakdown. The US healthcare spending per person. Okay, now I'm getting confused. Okay, let's read this. See if it can answer my confusion. The total U.S. healthcare spending per person, 15,474 approximately. Of that, so these are probably just not current figures, and this is from 2024, and an approximate. Okay, of that, the U.S. government alone, through Medicare, Medicaid, the VA, and other programs, spends roughly $8,000 to $9,000 per person and per year. Okay, that's what I wanted. So, the US government spends more per person per year on healthcare than the Canadian government does. And their people have to pay exorbitant healthcare costs and prescription drug costs. How is this allowed to exist? Like, holy. Public insurance programs include Medicare, Medicaid, and CHIPS account for 43% of all health consumption spending in 2024. 43% of 15,474 works out to roughly 6,600 just from those programs, and that doesn't include tax subsidies for employer insurance and other government support. To put that in stark perspective, the United States has by far the highest public per capita spending worldwide, even higher than countries with fully universal systems. Okay, to put that in stark perspective, the United States has by far the highest public per capita spending worldwide, even higher than countries with fully universal systems. Let that sink in. The US government alone spends more per person on healthcare than Canada's entire system costs, public and private combined. Canada's total per capita spending is 5,905, which that's the exact number it gave me up there. The US government spends more than that just through Medicare and Medicaid, and still leaves tens of millions of people uninsured. Americans also spend 1,078 per capita on health administration alone. The billing systems, insurance overhead, and paperwork that a single payer system largely eliminates. The conclusion many health economists draw is that the US is already paying enough in government money to fund a universal system. It just gets very poor value for that spending due to high prices, administrative waste, and a fragmented system. Prices appear to be the main driver of the cost difference, with the US having higher prices regardless of utilization rate. For instance, shorter hospital stays and fewer surgeries than peer countries, yet higher prices for each. That is crazy. So, the conclusion many health economists draw is that the US is already paying enough in government money to fund a fully universal system. So they could already have it. Like, I started this all because Trump was looking at legacy, and then I was looking at Tommy Douglas and how he was the greatest Canadian, and like isn't that the best legacy you can get? Be the greatest American? You're already spending the money. Like, you're already spending it. You're spending enough. You're spending too much money. You're already spending more than enough money to get a universal system. You just have to set it up properly. And then you would be known as the greatest American. But man, that's wild to me. Okay, well, I think I'm going to end it there. We definitely got thrown onto a tangent on that one, but now I got healthcare systems I got to look up, figure out how we can improve ours here in Canada. Oh, that's even more to the list. I removed one and I added one. It was a neutral day. It was a neutral day for the